Good afternoon. My name is Sheetal Malhotra, and I work for the Division of Audit Operations. Today, I'll be providing information on how to prepare a Formulary Administration Validation Work Plan. Our agenda today will begin by going through background, how to develop an approvable validation approach for FA, which will include sample targeting criteria, developing an alternative approach, and data requests for universes. We will then discuss 5 example scenarios, additional tips, and validation audit reports. Please note that this training will only cover formulary administration. We will not cover the other audit areas. The training was developed specifically for FA because of its technical nature that oftentimes requires a unique approach to truly validate the root cause. We'll walk through some of these examples based on feedback from past validation audits and point out factors to keep in mind to help guide development of future FA validation work plans. The hyperlink provided will take you to our Program Audit Process Overview document, which is a helpful resource that includes some basic principles to keep in mind when developing validation work plans and reports. The link will also take you to the current audit protocols for Part C and D program audits. The audit protocols are contained in a zip file, which also contains the validation work plan template. Please note that the information contained in this presentation is not new information and is based on the resources available. The purpose of the training is to be used as a supplement to these resources and to address specific scenarios in FA that may not always lead to a straightforward validation approach. Developing an FA validation approach. Identifying the sample targeting criteria is the first step to developing an FA validation audit approach. It is critical for the validation targeting criteria to be specific to the root cause found on the original program audit. The independent validation auditor and sponsor should have multiple meetings to discuss the root cause and impact analysis report from the original program audit, and the sponsor should assist with determining whether the testing criteria will test the original issue found on audit. And the IVA, or independent validation auditor, should update the validation approach accordingly. The sample targeting criteria will often contain the following: the types of rejections that will be targeted, which are not necessarily limited to specific codes, but also including the types of rejections since codes can change over time. The types of medications that will be targeted, including only Part D eligible drugs, and day supply if relevant to the root cause. Any additional factors that may be applicable, some of which we'll discuss in some of the example scenarios. The IVA should not choose samples if all criteria are not met. In the past, we've observed IVAs choose samples even when the universe is clean and samples do not meet the original criteria outlined in the approach. In this situation, samples chosen may be appropriate rejections and are not testing the root cause. This may result in the IVA having to select and test new samples. Keep in mind, we only want to sample for rejections that are potentially inappropriate. As mentioned, in the scenario the universe is clean, test claims or another alternative approach would be carried out, which we'll discuss further on the next slide. The IVA should include the alternative approach in the validation work plan. Since the expected outcome is that the sponsor will have corrected the issue, the universe may likely be clean, and therefore samples that meet the criteria may be difficult to find. Thus, an alternative approach is necessary. In the event an alternative approach is required, the sponsor should reach out to the validation lead to discuss and receive approval to carry out the alternative approach testing prior to proceeding. In program audits, the universes requested are the Rejected Claims Formulary Administration, also known as RCFA, the Rejected Claims Transition, or RCT, prescription drug event, or PD, and new enrollee, NE. However, for validation audits, universes requested must be based on the nature of the root cause. For example, for FA issues that do not impact transition, RCT universes are not necessary. For prior authorization or PA effectuation issues, a coverage determination or CD universe may be necessary to validate the root cause. On occasion, a greater period may be required to obtain a full sample set. Universe requests should be based on current and relevant time periods, and the CMS approved formulary is often required as a resource. Next, we'll walk through some example scenarios. Example 1. A sponsor was cited for applying unapproved utilization management practices because it did not account for specialty tier medications that are available in the smallest available marketed package size to pay when being submitted above a 30-day supply. The IVA should request an RCFA universe. The types of rejections would include day supply limits, such as, but not limited to 76, plan limits exceeded, and 7X, day supply exceeds plan limitation. The types of drugs would include drugs available in the smallest available package size and in Tier 5, which is typically considered the tier for specialty medications. As a reminder, these drugs should be identified by the IVA using the CMS approved formulary and not from a sponsor supply document. Day supply. Sample claims must be for greater than a month's supply. Since day supply is a factor for this root cause, this must be included as part of the criteria. Day supply may or may not be included in the criteria for other scenarios if it is not a factor contributing to the root cause. The alternative approach for this condition should include test claims with the same criteria outlined above. For example, the test claim should be for a smallest package size type drug that is in Tier 5 and that will be submitted for a 90-day supply or greater. The alternative approach should contain the same level of detail as the original validation approach. All criteria should be outlined. Example 2. Sponsor was cited for improperly effectuating exception requests because quantity limits were applied when entering non-formulary exception requests that were not based on maximum dosing limits established by the FDA. This type of condition lends itself to requesting coverage determination universes in addition to the RCFA universe. In order to evaluate effectuation, a CD approval universe should be obtained, specifically the standard coverage determination exception request universe. For the RCFA universe, the time frame should occur sometime after the CD universe, and we recommend a minimum of 2 months of rejected claims. Types of rejections. Sample selection should target rejections from the RCFA universe related to quantity limits that are after the date of effectuation of the CD approval. Targeting claims prior to the date of effectuation will not test the root cause. To validate this issue, auditors would review the CD authorizations to ensure there are no quantity limits entered. Additionally, review the sampled claim rejections for appropriateness. Claims should not be rejecting due to the manner in which the authorization was effectuated. Example 3. Sponsor was cited for an eligibility issue due to failing to ensure enrollees' eligibility remained active in accordance with CMS enrollment records. Sponsor disenrolled enrollees prior to CMS approving the disenrollment transaction. For the RCFA universe, it is recommended to expand the universe period to a minimum of 2 months to ensure we have enough data to choose targeted samples. The sponsor would work with the IVA to obtain eligibility information stored in marks. The types of rejections would include eligibility types of rejections, such as 69 or others. The additional criteria would include rejections that appear inconsistent based on the enrollment dates populated in the universe. For instance, the enrollee appears to have active enrollment, but is being subject to an eligibility rejection. Since IVAs do not have access to marks, it is recommended that the IVA narrow the RCFA universe to a set of 20 rejected claims for unique enrollees that meet the criteria discussed on the previous slide. The sponsor would then provide eligibility screenshots with all associated transactions for the enrollee from marks. The IVA would be able to target and select 10 samples for enrollees that have active enrollments and marks at the time of the reject. These samples would be reviewed further to determine if the rejected claim is appropriate. Example 4. The sponsor was cited for failing to provide continuing enrollees transition supplies of medications removed from the formulary across contract years. Since this issue impacts continuing enrollee transition, the following universes are necessary. PD universe. Only enrollees with history of the drug are eligible for continuing enrollee transition. Universe period time frame should be based on the sponsor's look back for these enrollees. The IVA would prepare a database with the negative formulary changes. This can be achieved by comparing the previous year and the current year formularies to determine which drugs have been removed from the formulary and/or which drugs may have added in the new year. Drugs that undergo a negative formulary change are eligible for transition fills. Based on the nature of this root cause, the auditor only needs to obtain the drugs removed from the formulary in the new year. For the RCT universe, the time frame must be January and/or February. Since continuing member transition cannot be tested mid-year, January and possibly February must be used for the time frame of the rejected claims transition universe. The RCT universe should be matched to both the PD universe and the negative formulary changes to ensure the enrollee meets the sample selection criteria, since a continuing enrollee would only be eligible for a transition fill if they have history of the drug and the drug underwent a negative formulary change. The types of rejections would include any type of rejection indicating the drug is not covered. Additional criteria, as we discussed, enrollee must have history of the drug within the sponsor's look-back time period and limited to drugs that went from formulary to non-formulary in the new year. Example 5. The sponsor was cited for failing to provide continuing enrollees transition fills of medications removed from the formulary across contract years during the full 90-day transition period. The transition fill period for non-formulary negative changes was set to a term date of 3/13 instead of 3/31. All criteria from example 4 would apply to this scenario, except for a few modifications. This is a unique scenario impacting continuing member transition that was limited to the March timeframe. The universe time period would be March instead of the typical timeframe of January and February. In order to target for this root cause, target rejected claims in March that have a paid claim for the same drug for a 90-day supply in December of the previous year. The paid claim would be obtained from the PD universe. Since most enrollees get their transition fills in January or February, we would apply the criteria in this way in order to evaluate whether enrollees receive transition fills in March. This issue can be validated by reviewing the sponsor system to see if a paid transition fill occurred. Additional tips. The validation audit should be conducted independently by the IVA. Auditors should keep this in mind when developing a validation approach. This can be achieved by minimizing additional requests for data from the sponsor. A full universe should be requested whenever possible. Issues related to quantity limits should be targeted by selecting rejected claims that are within a sponsor's formulary quantity limit. Selecting rejections that exceed a sponsor's quantity limit are considered appropriate rejections. For extended day supply issues, testing with a 90-day supply is highly recommended. Issues impacting continuing member transition typically utilize a January-February timeframe. Continuing enrollee transition cannot be tested mid-year. As we discussed, example 4 utilized a slightly different timeframe based on the root cause. March is still within the 90-day transition window, but should not be used generally for transition issues, since most enrollees receive their transition supplies in January or February. CMS, not the IVA, determines whether audit sample results meet criteria for the audit conditions to be considered corrected and for the audit to be closed. Any deviations in the original validation approach should be discussed with the validation lead and documented in the validation audit report, including the rationale for the deviation. This includes if the IVA needs to carry out the alternative approach proposed in the work plan. Please feel free to reach out to Daryl and myself if you have any questions while developing the FA validation work plan. We hope this presentation has been useful for guiding auditors in developing work plans for FA. Please reach out to our mailbox if you have general questions or have any suggestions for program area trainings you would like to see in the future.